Good evening. I am Selwyn Collins, your host of CWS Conversations with Selwyn. Those of you who are joining us for the first time, thank you for joining us. And CWS is about having conversations with people about their journey and how are they using their gifts and talents to help others. As such, I'm always looking for someone who has a story to tell because I believe each of us has something to say. And I believe when we share our stories, when we talk about our successes, but more importantly, our challenges and how we overcame some of those challenges, how often we get up, I think that evokes in us the essence of our humanity, and I think it connects us in a very special way. And so I'm always encouraging people to believe in their ideas, to commit to their ideas, and to pursue them. Not so that the success that comes from the pursuit of these ideas might glorify them, but so that those successes can be seen as beacons of light. Because I believe that when we are successful, it is not just for us, it is to remind others that they too can. It is to demonstrate to others that if they try, if they pursue, if they commit, if they get up when they fall, they can be successful. And I think that when we are successful and we encourage others to try, I think that helps us tremendously. I'm often asking people when I invite them on the show, imagine someone listening to you talk about your successes, but more importantly, how you might have overcome a particular challenge. And imagine that young person one day becoming the head of state of a country, someone who discovers a vaccine that saves millions of lives, someone who becomes a geneticist or an oncologist or something of the sort. You see, we never know, we can never know. But what is most important is that we are able to give beyond ourselves, we are able to give without expectations. And so I'm always encouraging others to give and not to look to see the extent of their gifts. I often use the example of many leaders that have gone before us, like Martin Luther King and Malcolm X, who have made ultimate sacrifice, the ultimate giving, without needing to be around to see the extent of their sacrifice. Yep. Excuse me. We are back with Dr. Oneeka Williams. For those of you who are joining us for the first time, I'm Selwyn Collins, your host of CWS Conversations with Selwyn. Good evening, Dr. Williams.
Good evening, Selwyn.
And how are you this evening?
I'm very well, thank you.
Well, thanks for coming on.
Thank you for having me.
How may I address you this evening?
Onika is perfectly fine, thank you.
Wonderful. I want to start off with your bio, and then we'll get started. Is that okay?
That's fine.
Okay. Dr. Oneeka Williams is a Harvard Medical School graduate who ranks among the top urologic surgeons in the United States. A native of the Caribbean, she was born and raised in Guyana, South America, and moved with her family to Barbados at the age of 10, where she attended Christchurch Foundation School and Harrison College. From an early age, her science teacher mother and journalist father instilled in her a love for the sciences and writing. And this in quotes. My childhood was filled with the joys of discovery and exploration as my science teacher mom took every opportunity to expose us to the wonders of science. On the other hand, my dad shared his passion for writing, and I grew up writing poetry for every occasion, including birthdays, holidays, and family reunions. Dr. Williams' professional journey includes an undergraduate degree in biophysics at Johns Hopkins University, graduate degrees in public health and medicine at Harvard Medical School, and surgical training at leading academic medical centers, including Massachusetts General Hospital and the Lilly Clinic. Through her volunteer work in the community and as a teacher and mentor, Dr. Williams is committed to inspiring all children, especially girls, towards a greater interest in science, a positive attitude, and the pursuit of excellence in all their endeavors. To further her advocacy of literacy and science education, she's authoring a series of children's books. Her first two children's illustrated picture books, Dr. D. D. Dynamo's Mission to Pluto and Dr. D. D. Dynamo's Meteorite Mission, were both published in 2013. A third book in the series will be coming out in the summer of 2014 with more titles to follow. And there are more, but let's get started. Dr. Oneeka Williams, welcome to CWS. I read that your name Oneeka means the ability to organize, plan, and carry through to a successful conclusion. Since it will be silly for me to ask if this is accurate, I'll just say congratulations on all your endeavor in and out of the medical field.
Thank
and
you
much
very much.
respect for being so determined and driven.
Thank you.
Were you determined and driven as a child, or did it start later in life? And who or what do you believe is responsible?
I've always been determined and driven, and I would have to say that the number one people in my life that was able to tie the knots and do all the practices that made me very comfortable and helped to increase my surgical skills. And so the combination of just being good with my hands, loving being in the operating room, having that operating room type of environment that can be very energizing, and urology, I knew that I wanted to be a surgeon, and so I decided that trying to decide, well, what area of surgery do I want to go into? And so I was rotating through the various sort of specialties and subspecialties and thinking about what seemed to appeal to me. And I did a rotation, which was an outpatient rotation at the West Roxbury VA, and I was assigned, it was an outpatient sort of internal medicine or family medicine type of rotation, and I was assigned to the urology clinic for one of those sessions. And arrived at the clinic and met the residents, and this was a resident-run clinic, so they're still in training, and they're seeing those patients. And the first patient that I saw was an older gentleman who had the misfortune of having this, what is sort of in layman's term known as this flesh-eating bacteria of his genitals and scrotum. And so in order to save his life, the urologic surgeons had to remove all of the skin that surrounded his testicles and essentially all of the scrotal skin. And then you're left with this, the quandary of, well, what to do with the testicles. And so what they did with the testicles was implant them into the inner thigh of this patient until such time that he had healed, and he could then have, the genital reconstruction to reconstruct his scrotum. And I thought that was the most fascinating thing ever. And that was it. I was sold. I said, this is what I want to do. And that was my first exposure to urology. And and from there, I then, learned more and began to understand and appreciate more about how diverse of a specialty it was, about how incredibly rewarding it was, about how it really spoke to the things that I really enjoy about medicine, which is not only, or surgery, which is not only sort of operating, but also having personal relationships with patients, having continuity of care so that, I would be able to not just be a technician where I operated on them and then, saw them once post-op and then they went about their merry way, but that I would have a constant and a consistent relationship that allowed me to follow them over years so that I became, really a primary provider as it related to that particular problem that they were presenting for. And then, we build a relationship where I began to know them, and not only just as, well, they're coming in with a cancer of their kidney, but to appreciate and to understand, the whole person that they were, the holistic view, to learn about their families, to learn about their challenges, to learn about their successes. Those are the things that in medicine that I enjoy tremendously. And so urologic surgery really allows me to marry the surgical aspect as well as that interpersonal patient care perspective.
I'm going to ask you this question and then we'll take a quick break. It's two parts. What challenges did you have during medical school? And can you tell us how you overcome that, or what challenge you overcame that you're most proud?
Well, I would think the challenge that I, had, and it wasn't necessarily in medical school, but I'll start with just college. And the
Okay.
thing that I'm most proud of is when I arrived at Johns Hopkins University, and Johns Hopkins University is an amazing, and my experience there was, one that was extremely, I think, did incredibly well preparing me for where I am now. But Johns Hopkins is known as one of the pre-med capitals of the world. And they are, people go there because they want to go into medicine. It's well recognized and well known. And so, they have a very well established sort of system in preparing their undergraduates from the time you arrive and you express an interest in medicine, in preparing you for what it takes to get from the first day that you arrive there till the time that you graduate. And when I arrived at Johns Hopkins, I was an international student because I was, coming up from, Barbados, from Guyana, and I had no status. And so the pre-med advisor at that time had a general meeting for everyone who was interested in going into medicine, but then she had a separate meeting for those who were international students, and she met with us individually. And so that first week that I arrived at Hopkins, I went to her office and, to have this meeting, which I expected was going to be, okay, here are some of the challenges that you might face as an international student, but here is a roadmap about how you're going to navigate through those particular challenges. And she said to me when I got there, she said, well, I just wanted to let you know that you are, as an international student, you will not get into an American medical school. And so you should start preparing to go back to the Caribbean to go to medical school there. And it was almost as if, first of all, this was the first time I had ever heard that I couldn't do something, because coming out of the Caribbean, everyone, around us was, okay, well, you've done this well. Now what else can you do? Or, how much better can you get? You always can do more. And, so I was shocked. And I think, it was like whiplash. Once I recovered, I says, well, I don't understand, what you mean, because number one, you don't really know anything about me. You know nothing about my performance. How could you make such a generalization that I would not get into an American medical school? And she says, because international students don't get into American medical schools, you would have to be an exceptional student to even be considered. And the thing that I'm most proud of is that because I was blessed to grow up in an environment where I was always told that I could, I decided that she was clearly not someone that I needed to interact with anymore. Mm-hmm. And so I never went back to see her. I then found other resources to support my desire to get into the medical school in this country. And I went back to her when I was about to, graduate. And, I was a biophysics major. I graduated a semester early. And I got into every medical school that I applied to, and I only applied to, the top medical schools. And I went to her and I said, do you remember me? And she said she couldn't remember me, of course. And I said, well, this is what you told me when I came to see you my first week at Johns Hopkins. And I wanted you to know that here is what I've been able to achieve while I was here, and here are the medical schools that I have gotten into. And her response to me was that, well, you're an exceptional student. And I said, no, I don't believe that to be the case. I said, your role here is one to advise and to encourage and to create a framework and structure to help people to succeed. And had I come from a different background, had I been a different type of person, had I not had the parental support and the family support that told me that, she doesn't know what she's talking about, ignore her, you just continue to pursue what you know that you have gone there for, had I not had those type of supports, that she could have completely derailed what I had set out to do. And I said to her, you could have changed someone's path and someone's destiny just by those words that you uttered without even giving it any thought. And I hope that this is a learning experience for you, so that you will not do that to the next person that comes across your threshold, and that you view them and that you make decisions and you make assumptions about what they are capable of based on whether it's the way they look, whether it's where they're from, based on these beliefs and stereotypes or information that you believe to be true, that you make, these judgments without being open-minded, and thus creating situations where, you could completely discourage and change, someone's course. And so I'm most proud of having, overcome that particular challenge and having been able to go back to her and use it as an opportunity for her to hopefully learn and hopefully not, repeat that same error with, someone else coming after me.
What an inspiring story. Let's take a quick break.